coronavirus is spread through respiratory droplets that are passed from person to person. You can protect yourself and your patient by practicing good infection control habits, like social distancing, wearing a mask and gloves, covering your mouth when you sneeze or cough, and washing your hands properly. These techniques and practices are the best defense we have against the coronavirus and will help to decrease the risk of spreading the disease. Work with your patients so that they develop these good habits as well. Tell them why each habit works to prevent the spread of the disease and encourage or remind them about these practices during your days together. Social distance or stay at least 6 feet away from others when possible. Research and science have shown that respiratory droplets that carry the virus can travel up to 6 feet away from the person who is carrying the virus. Staying 6 feet apart from others can decrease the risk of getting the virus. You can help your patients socially distance by taking care of chores outside of the home on their behalf. For example, you can go to the grocery store, wearing a mask of course, to pick up items on their list while they're safe at home. As caregivers, it can be more difficult to socially distance from patients that we serve. This is when a mask comes in handy. Wear a mask when indoors and when impossible to socially distance. Wearing a mask outdoors when social distancing is impossible is also recommended by local, national, and international agencies. A mask helps to decrease the number of respiratory droplets that leave the wearer's mouth or nose, further preventing the spread of the disease. When caring for a patient when socially distancing is impossible, wear a mask. For example, wear a mask when you're providing personal care to your patients, such as bathing or toileting. Also, wear your gloves when providing personal care. Encourage your patients to wear a mask when out of the house, such as when they're going to a doctor's appointment or the grocery store. Cover your mouth with a tissue when you need to sneeze or cough, and then wash your hands or use hand sanitizer immediately afterwards. The coronavirus can also live on surfaces, which makes washing your hands even more important to decrease the spread of COVID-19. Wash your hands for at least 20 seconds using soap and water. You can count to 20 or sing the happy birthday song twice through to make it to the 20-second recommendation. If soap and water are not available, you can use an alcohol-based hand sanitizer. Wash your hands before entering a patient's home, before preparing food, after coughing or sneezing, before and after patient care, and throughout the day. Encourage your patients to wash their hands on the same schedule too. Aside from washing your hands and encouraging your patients to wash their hands, you can also make it a habit to avoid touching your face. Coronavirus that lives on surfaces can transfer to your hands when you touch the surface. Then, if the virus is on your hands and you touch your eyes, mouth, or nose, the virus can find its way into your body. Disinfect high-touch surfaces throughout your home and your patient's home throughout the day. These surfaces can include countertops, tabletops, doorknobs, walkers or canes, and TV remotes. In conclusion, protect yourself and your patients by following these recommendations. Social distance from others at least 6 feet apart. Wear a mask when social distancing is not possible, especially when providing personal care to patients. Use gloves when completing personal care tasks. Cover your mouth. Wash your hands for at least 20 seconds multiple times throughout the day. Avoid touching your face. Disinfect high-touch surfaces.